So what is exactly a joint fixation?
Joint fixation is a situation where there's an impeded movement of the joint.
And a
So,
joint is,
and a joint, again, remember, just so we know what we're talking about, a joint is where two bones come together.
mhm,
And so you'll have bones coming together, but the body won't allow bone on bone. So you'll have cartilage, which is like a glassy substance on the surface of the bones. And those tend to absorb shock. And then you'll have a ligament, usually called a capsular ligament, that goes around the joint. And then inside that capsule is fluid, which is the joint oil, which is called synovial fluid. And the ligament tissue around the joint will hold the joint to a certain movement, so it doesn't allow it to go too far. And so as movement occurs in that joint, there's little glands around the joint, and those are little synovial fluid glands. They're like saliva glands in our mouth. So when there's movement in the joint, then those little glands secrete, and they secrete joint fluid. So that lubricates the joint. So you'll have ligaments holding the joint, and then to create motion of the joint, you'll have muscle tissue. So the muscles then move the joint, and that the muscles will determine in a way how far the joint can go. The ligaments determine the kind of the intrinsic motion of the joint. They hold it to a point, and the cartilage doesn't have a lot to do with the movement unless it's quite deteriorated. And so if you have a joint which is unable to complete a movement, then we call that a fixation.
okay.
So there's other words like subluxation. In chiropractic, the word we're using here is fixation, and that just means some type of a block of the joint. And then to break it down a little bit, the most common fixations of a joint will be muscular, where the muscles have shortened for whatever reason, and that impedes the movement of the
Like they
joint.
spasm down.
Yeah,
Yeah.
or even just hypertonic. It doesn't have to be spasm. And then if the problem is more chronic, or there's been a bigger issue like a big whiplash type thing, then there's actually a tearing of the ligament or a chronic shortening of the ligament, and that impedes the joint much more than a muscle fixation. So muscle fixations allow a lot of movement. Your ligament fixations allow way less. And if that tissue then hardens, so if the muscle tissue hardens, the ligament tissue hardens, the joint motion is impeded, the synovial fluid is not being secreted, then you tend to create a atrophy or a hypomobility of that joint, which is a restricted motion of the joint. And the problem with that is the tissue around it now cannot perform.
Right.
So that can become a chronic issue. Your osteoarthritis and different ankylosing diagnoses where you've actually hardened the joint, those are where the joint has become fibrotic, meaning it's like a scar tissue. So to the extent those can be broken down, if you can change a fixation, you can restore motion to it, then everybody's happy again.
And that's what a chiropractic adjustment does.
An
Correct?
actual chiropractic adjustment actually serves to restore the function of a joint.
So you were talking about how a joint fixation causes a lack of motion in the spine. What happens to the joints around, above, and below when you have that kind of fixation? Why is it important to clear that restriction out of the body?
If you have a more chronic fixation, let's say ligament, if you impede the motion of a joint too much, what happens is the joints to the side, the joints above, have to move extra. So you can call a restricted motion a hypomobile joint. You can call the joints with excessive motion hypermobile joints. So if you have a chronic hypomobility, then the area above will become hyper.
Right.
So those joints move excessively. So for example, if you have a spinal fusion at your fifth lumbar, in a couple of years you're going to have problems at your 3 and your 4, because since the 5 isn't able to move, the 4 and the 3 become hyper.
Right.
And you'll get degenerative changes in the 3 and the 4
Right.
because of the restriction below. So if you have a chronic issue in a joint, you will develop an issue in the joints above that. So if you have a foot which is pinned and plated, for example, after you get it run over by a tractor, then in a year or so you'll start developing knee problems on that side because the knee joints now have to move extra to do the work that's not happening for the foot. So if that continues, that joint will actually wear down, and that will be your osteoarthritic joint.
Bone spurs.
Yeah. So the good chiropractor is looking for the areas of restricted motion to break those down to stop the areas of compensation.
Exactly.
And where health practitioners, including chiropractors, can get into trouble is they tend to treat or manipulate a joint that's already too mobile. And when that happens, it makes it more unstable. So sometimes a person will go to a physiotherapist or a chiropractor or a masseuse and get worse as treatment continues.
Right.
And then the actual scenario there is that the area being worked on is not a primary issue.
Right.
Or it's something more exciting like a tumor or a visceral somatic problem. And again, the visceral somatic will make it appear to be an area of the spine, but it's actually secondary to
The
stomachs and
digestive
livers.
system, or
Yeah.
something like that.
So you have to kind of know after years of practice what not to manipulate and what you should manipulate first. That becomes kind of the art in chiropractic. The art in chiropractic is many times knowing what not to do, not what to do.
And not necessarily listening to your patients when they say, oh, it
Yes.
hurts right here.
Yep. Because remember, the area of pain is the area of inflammation. Why is there an inflammation in that joint? Because it has an erratic movement.
Right.
Why does it have an erratic movement? Was it an injury or was it compensating for something else? If it was, do not manipulate that joint.
Right. Right.
Because the patient will have the recurring scenario if it keeps being manipulated. So you find out what the actual restriction is. Maybe it's a foot, maybe it's a short leg on one side. See, so what is causing the compensation is more the question.